Thank you all for having me here. It's a pleasure to be here and a wonderful introduction into what I think is a really important, new frontier looking at particularly female athletes and how we can best get everything out of their performance, not only at an elite and high performing area, but also starting at a community level. So this is me. I've done a lot of study over the years. I'm just trying to figure out which clicker, making sure I get this right. Clicker. There we are. As obviously has been discussed, I'm very proud, and on behalf of City Fertility, we're very proud to be here as gold partnerships with Swimming Australia. We've got a real opportunity to increase the education and the awareness around female physiology and how that actually influences upon the female athletes. And it's probably an area that we need to do a lot more research on, and definitely just opening up the conversations and making sure that this is a normal conversation for athletes, for high-performing off-field staff and coaches, and even parents, to make sure that everyone is comfortable and understanding that this is something that we can potentially address and hopefully improve the athletes' performances in the long run. A little bit about City Fertility. Obviously, you guys have got a lot of information in front of you at your tables, but we're an organisation that is nationwide, supported by global partnership with CHAR IVF, and we have over 60 specialists across the country, multiple labs and gynaecology clinics, and we're really interested in focusing on female and male fertility, but also any particular health needs that female might have from a gynaecology perspective, and we're really interested in making sure that we address all your individual needs. So I'm very proud to be partnered with City Fertility. This is me when I'm not presenting at conferences. I'm actually on maternity leave at the moment, but this is me in my day life. I work publicly at the Royal Brisbane Hospital in Brisbane, as well as working as a private specialist for City Fertility. So I'm very excited and love my job that I get to be able to help babies grow, bring babies into the world, and operate on patients from a gynaecology perspective. Throughout my training in gynaecology and obstetrics, I was also very lucky enough that I had a very successful sporting career. Always loved sport, was never a great swimmer, but I was a great runner and an athlete, and I played in the AFL women's competition for 4 years. I was one of the inaugural draftees in 2017 and had a successful career at the Western Bulldogs and then on to the Gold Coast Suns before hanging up the boots and focusing on my medical career. Probably winning the Premiership in 2018 was probably my highest sporting achievement. And it was actually during my time being an AFLW athlete that I recognised that there was a huge lack of education around the menstrual health and female physiology. I was having my fellow athletes and fellow team members hit me up for a consult in the ice baths asking about Doc. My nickname was Doc. They would say, I haven't had a period for 6 months. Is that normal? Or I'm getting really, really bad period pain when I'm playing, and that's impacting upon my training and performance. And I really recognise there as an athlete that there is a huge lack of awareness, lack of knowledge, and there's a huge educational piece that we can introduce into all sports within Australia. And I think that Swimming Australia are becoming true leaders in this field by taking recognising that this is an area that they can improve in. So today we're going to obviously go through what is normal for a female. We're going to look at a little bit of the, female hormones and menstrual cycle and really, address what is normal for a female initially. And then we're going to look at some of the things that are actually not normal or may be something that we can actually address from a gynaecology and a fertility perspective. We're going to have a brief conversation about the key importance of research into female performance and the impact upon menstrual cycle. And then we'll have a look at some of the resources, and particularly a really exciting resource, an Ignite athlete that City Fertility have been working behind the scenes very, very hard to be able to release and have that available for athletes. So I guess these are the statistics to probably address the huge disparity and lack of education and awareness, is that we think that probably 90% of female athletes have experienced negative symptoms associated with their menstrual cycle. And we think that about 50% of them perceive that their training or performance has actually been negatively impacted upon by their period. And I guess the alarming rate is that some statistics that came out of FitR and Strava research that was done a couple of years ago recognise that 80% of the time they actually haven't ever discussed this with their coaching or off-field support staff. And we know that based on this research as well, that in the women that which were surveyed, and these were both community level athletes as well as elite athletes, that 80% of them actually had never received any formal education or knowledge around the impact of menstrual cycle on their performance. Probably some other interesting statistics, and these were coming out of Griffith University on the Gold Coast. Claire Minahan has been a leader within the women's female athlete space, and she had surveyed some elite athletes recently and found that 90% of them actually scored as a poor level of knowledge based on just basic menstrual health. 47% of them actually were on some form of contraception, and that was an attempt to try and, I guess, manage their periods, and 73% of them were on an oral contraceptive pill. And we know that there needs to be a lot more research around menstrual or hormonal manipulation with hormone contraception and how that may actually then influence risk of injury as well as performance. And 53% of elite athletes who were not using any form of hormonal contraception in one of these studies demonstrated that, or recognised that there was definitely an area within their menstrual cycle that they felt that they performed better. And we need to learn a little bit more about this. The challenge with the research is that only 6% of all high quality sports and exercise literature is purely based on a female athlete population, which is obviously very poor and is an area that we need to increase. The concern or the challenge is that at the moment there is significant research heterogeneity. So all the studies are different, are performed differently. They've got different study applicants, they've got different guidelines, they've got different things that they're looking at, and it's a real challenge then when we're looking at trying to make sure that we've got good high quality evidence in this space. All the research is at this stage has all been performed in different ways. And then through that research piece, we need to be able to figure out what is actually useful research. So the challenge is every female may have a different menstrual cycle, and so then how are we actually going to find measurable data collection capabilities within research? It's also very important to try and figure out then, well, with the research, if we were to figure out if there are particular areas in the menstrual cycle that may be better for training or performing perspectives, how are we actually going to then change behaviour from an athlete's perspective? So I guess brief background education on female physiology is that as females, we're designed to have babies and continue the evolution of the human species, and we've got two very important hormones, estrogen and progesterone, that are influential in the menstrual cycle. Estrogen is required for ovulation, releasing an egg from the ovary, and is very important for also bone strength and cardiovascular health, so it has multifactorial influences. Progesterone is important for supporting the lining of the uterus, preparing for hopefully a little fertilised egg to implant into the wall of the uterus and for us to have a baby. These hormones also then have an influence upon how we train and perform as athletes. Brief look at the menstrual cycle is that you have a period at the start of the menstrual cycle, so from day 1 to usually day 5 to 7 you can have a period bleed, and then you will have a rise of estrogen, which reflects a growing follicle on the ovary, which will be then released in the middle part of the cycle. If that egg has the ability to be introduced to sperm, then hopefully fertilisation occurs, and the little fertilised egg is implanting into the wall of the uterus and a baby's made. Now, majority of the time that doesn't happen, particularly when we're not planning for pregnancy, and so progesterone rises in the second part of the cycle, and we know that that does have an influence on performance as well. If the egg isn't fertilised, then the corpus luteum, which is a little structure on the ovary, which stops producing progesterone, and the cycle starts all over again. So every month, female that is not on some form of hormonal manipulation is going through this cycle, and so you can see that there is a significant change in estrogen and progesterone throughout a sort of a monthly cycle, and this may have an influence, and this is an area where we need to learn more about how it actually can impact upon risk of injury, performance and training. So what is considered a normal period? So periods can vary in length. So one athlete may have a 21-day cycle, other athlete could have a 35-day cycle, and that's completely normal. And there's often a 1 to sort of 3 to 4 day discrepancy every month. So if an athlete was tracking their cycles, they may say one month it might be 28 days, the next month it might be 30 days, and that can be considered normal. We know that there's differing levels of flow of menstrual blood, and that sounds sometimes uncomfortable to talk about, but it is actually something that we do need to talk about because 50% of the population has a menstrual bleed. But of that menstrual bleed, it needs to be important to know that there is what is considered normal flow, and then there's obviously considered heavy flow. And if you're having clots, then that's something that would be of concern, and you would need to have that athlete potentially have a chat to a gynaecologist. Period cramps can be normal, and that is something that a lot of women do experience. But if you're finding that your day is influenced by that pain, then that is not normal, and that's when they probably do need to actually have a chat to a doctor about it. In the follicular phase of the menstrual cycle, which is that first early phase, you're having the menstrual bleed and then you're having the growth of the follicle, that first early stage of the menstrual cycle, you can have significant changes in symptoms as well, which can be considered normal. So you have your period, but athletes could potentially also be feeling fatigued, and they may have some cramps, as I briefly discussed. And this is a low estrogen and progesterone space, and this is an area where we're very interested in looking at research because there may be changes in strength as well as high-intensity interval training performance levels, particularly in this early stage of the menstrual cycle. Ovulation, we've got peak levels of estrogen, and you may get athletes that have twinges of pain, particularly associated with ovulation. And again, this is a space where we may find this estrogen is influencing upon performance. The luteal phase is the high progesterone phase, and we know that looking at endurance runners as well as elite rugby players, that potentially that they have higher endurance levels, looking at the current research that's coming out of that. We don't really know what's happening in swimming. We haven't had a good look at data based in the luteal phase in swimming athletes that I'm aware of. But you can get a significant number of symptoms in that second half of the cycle, which can be something that athletes may find that actually does influence upon their training and performance. So you can get headaches, bloating, mood changes, fatigues, they could have breast tenderness. So all of these things, particularly at the high performing levels, may actually have an influence upon performance. Premenstrual symptoms. So premenstrual symptoms, a lot of women will experience premenstrual symptoms, and there's a significant array of different symptoms that some people may experience mildly, others may be severely affected by it. In fact, there's over 150 different symptoms that females may experience, and this is usually just before they get their period. We know that, unfortunately, it's something that we don't know a lot about from a research perspective, and that there's 5 times more studies looking at erectile dysfunction, which we know that only a small number of men actually experience, whereas over 90% of females will experience some form of these symptoms. And this just demonstrates that this is an area of research that we need to increase. As I just touched on briefly, there are possible impacts upon performance or athletic performance in differing phases of the menstrual cycle, but key caveat is that there is significant research heterogeneity, as I previously mentioned, and so when we're looking at the data, we need to be very careful about how that compares towards your athlete population, because we know that the data these research articles have been looking at all different types of athletes. We know that from a strength perspective, that looking at rugby athletes and soccer athletes, that potentially they're stronger in that first half of their cycle. As I briefly had chatted about before, endurance can be increased in the second half of the cycle in some athletes, particularly endurance runners. Some athletes may find that their recovery is actually impaired in brief in sort of certain periods of their cycle. Now, I haven't put any references on this slide, and the main reason is we need to be careful when we look at this data and in comparing it to your population. It's a very important and really exciting opportunity from a Swimming Australia and City Fertility perspective that we can collaborate on some research opportunities with your own athlete population. Perceived performance is probably the biggest thing, is because from one athlete to another, one athlete may find that their menstrual cycle has a significant impact upon their training and performance, whereas the other athlete may not have a significant, feel it has a significant influence. And this is where it becomes a challenging area of research, but an area that we have a real opportunity, particularly within the high performance space. Some athletes do turn to medical management options when they do have symptoms that they may find has an influence upon their day-to-day life and training. A lot of women are on the oral contraceptive pill. There comes with risk and benefits of being on that. It could be from a contraceptive perspective that they're on it, but it also can have an impact upon managing their menstrual flow and symptoms associated with their menstrual cycle. A non-hormonal option is tranexamic acid, and some women do take that to reduce their menstrual flow, and the Mirena is becoming a more increasingly frequently used contraceptive device, but also hormone menstrual suppression option, particularly someone that might have side effects associated with the oral contraceptive pill or just not very good at taking tablets. But it would be really important to look at the individual athlete, whether or not these are suitable management options for them, and that's when it would be important to make sure that they're referred to and seen by a gynaecologist that has experience, particularly looking at medical management of menstrual dysfunction. So moving on to when athletes should actually think about seeing someone. So if you're having menstrual irregularities, it is something that, you know, one month it might, the athlete may have a 21-day cycle, and then they don't have a cycle for 3 months, and then all of a sudden they've got a cycle again. That's a time when they do need to actually see someone, and this is where, from an off-field high-performing cohort of coaches and support staff, is that having these conversations with athletes to make sure that they're actually having regular cycles is important, and making sure that it is not a taboo topic, that it is something that is an open conversation, particularly within the high-performing space. If they're having severe pain, if they're having heavy bleeding and flooding of their menstrual period, then that's when they need to see someone, and things can be done to improve those symptoms. If they're having pain with intercourse or pain with opening their bowel or bladder habits around the time of their periods, this is also symptoms that would need to be investigated further. And I guess the main thing is that making sure that you are referred to a specialist that has an experience from a gynecology perspective. Briefly just touching on two other really important menstrual dysfunction conditions. Polycystic ovarian syndrome and endometriosis is a very common conditions, and even within the athlete space you can have a significant proportion of athletes that may have symptoms to suggest that they have these conditions. So polycystic ovarian syndrome is a multi-organ endocrine dysfunction which can lead to menstrual irregularities. They could have significant acne, excess hair, and it does have an influence upon their mood. It has an increased risk of diabetes and cardiovascular disease later in life, and does have the ability to influence upon their fertility later in life as well. We think that probably 30% of women that have got polycystic ovaries on ultrasound can be completely normal though. So it's very important that you do see someone that has an experience in polycystic ovarian syndrome if you're concerned that an athlete may have some of these symptoms. Endometriosis is probably the other big one. There's been a big push in awareness and education around endometriosis, and we think that probably 1 in 9 women have endometriosis. This is a condition that has a significant array of symptoms. A lot of the time they can have pain associated with their periods. They could present with really heavy periods, pain with opening their bowel or bladder habits, or when they come to actually have a pregnancy or try for a family, they could have concerns with infertility. The challenge is diagnosis, because the gold standard diagnosis is laparoscopy, so surgery, and that's obviously something that you don't want to put an athlete through, particularly when they're training and preparing for events. But it is really important that they do see someone, and it's something that addressing it earlier is very important from a symptom control perspective, but also from a fertility perspective. Athletes' amenorrhea and REDS, I'm sure, is something that you guys are very well aware of, particularly within swimming and high-performing athletes, and it is something that does have lifelong influences if it's not addressed earlier. So from a REDS perspective, the impact of low estrogen and progesterone, or calorie deficiency, or lack of, or increased exercise demands or calorie deficiency will mean, from an evolutionary perspective, the athlete will be, their body will decide, I'm in no fit space to have a pregnancy. And so as a result, they will stop having their regular menstrual cycles. And if they're going 3-4 months without a menstrual cycle, without having any form of hormone manipulation with a pill or something like that, then it is something that does need to be addressed. It's a state of estrogen deficiency, estrogen and progesterone deficiency, and that can have consequences for their bone health, as I'm sure you are well aware of, but also from a fertility perspective can potentially have influences in the long run from a fertility perspective. The main thing is that identifying athletes that are at risk of this and making sure that you refer them early to a specialist, gynaecologist or fertility specialist to discuss this. So I guess where to from here, I've 16 years of research, or 16 years of study. I've just sort of tried to summarise in 20 minutes. But I guess the key points that we want to, from City Fertility's perspective, is to, I guess, put across to you is that we need to really increase education and awareness around the impact of menstrual cycle and hormone manipulation on the high-performing athlete. We need to increase the conversations on pool deck with the coaching staff, in the back of the cars with parents, about what potentially could be normal or symptoms that do need to be addressed by a specialist. And we're really excited about the opportunity for research looking at really measurable behavioural changes when it comes to making sure that athletes feel comfortable in accessing help, or first asking the question or trying to reach out if they're concerned about any of the symptoms that they may be experiencing. At the end of the day, our aim is to optimise athlete performance, and as one of the most successful Olympic sports in Australia, we have a real opportunity to potentially make sure that all of our athletes, from a holistic perspective, are performing at the best of their ability with lack of symptoms that may be influencing upon their ultimate potential. Really exciting opportunity, as I discussed, is Ignite Athlete has been developed with the idea of being a one-stop shop for both community or amateur athletes, elite athletes in the high-performing space, as well as making sure that support staff have a significant array of resources discussing all forms of health concerns when it comes to the female athlete. And the idea is making sure that we provide educational opportunities. Athletes can, or support staff can, look at the website in their own time. It can lead them to lots of information and resources around particular health topics in the female space, but also making sure that they have the opportunity to access specialists and doctors that may be able to help them if they do have any questions around their health in particular areas.